The next thing I'm going to address, the coronary circulation. My first comment about that would be the name. Coronary comes from crown, and the idea here is that someone looked at these vessels and decided it kind of looked like the heart was wearing a crown. And it kind of works like this. These gray, shadowy lines here indicate deep grooves in the surface of the heart. And there's one groove that wraps around kind of like a crown would. And there's another set of grooves that drop down between the ventricles on the surface of the heart. In those grooves run vessels that supply the heart tissue, the myocardium itself, with oxygenated blood and nutrients. So we need to talk about these major vessels. There is a left coronary artery that pops off the left side of the aorta. This would be just past the aortic valve. The aortic valve would be right here. Just right beyond it is an opening for the left coronary artery. It's going to sneak behind the pulmonary trunk. That's why the line becomes dashed. So a dashed line indicates here it's in back of something else. And it's only going to go maybe 1.5 centimeters, and then it's going to divide. It's going to split into two branches, two major branches. There's a left anterior descending coronary artery. This one drops down the front of the heart in between the left and right ventricles. Hooks around the back. It's pretty long, so it actually hooks around past the apex a little bit. The other major branch of the left coronary is the circumflex artery, and that goes around the back side of the heart between the left atrium and ventricle. Circumflex means bent around. That's what it's doing. Off the right side of the base of the aorta, we have a right coronary artery, and that right coronary artery is going to drop almost vertically down in between the right atrium and ventricle. It's going to wrap around the backside like that. Okay, and you can see here the circumflex artery coming from the left coronary and the right coronary artery are kind of pointing at each other, kind of like two locomotives on a track. What's going to happen? Well, there's one more artery. There is a posterior descending artery that drops down the backside of the heart in the groove between the two ventricles. In most people, about 2/3 of people, this posterior descending is a branch off the end of the right coronary. And we call that a right dominant coronary circulation because this branch comes from the right coronary. But that's not always the case. This posterior descending artery can instead come off the circumflex like this, right? So imagine this artery actually being over here, or the circumflex artery kind of extending farther and giving rise to this branch down here. We would call that situation a left dominant coronary circulation. And then the remainder of people, instead of one posterior descending coming off the right coronary or one posterior descending coming off the end of the circumflex, they have two little twin ones. Both the right coronary and the circumflex have small half-size versions of the posterior descending artery, and we call that a co-dominant circulation. And this is useful if you have an occlusion of a coronary artery that leads to damage. It's useful to know exactly how the circulation is arranged because you need to know if there's damage to part of the heart, which artery was occluded. Well, you need to know this to figure out maybe what's going on. There is one major vein that collects pretty much all of the venous blood from the coronary circulation and brings it back to the right atrium. It's called the coronary sinus. Sometimes we use the word sinus to mean a big, huge venous structure where blood can kind of slosh around in this big vein, big floppy vein. It's really big. So that's on the back side of the heart, draining blood from the capillaries of the myocardium and bringing it back to the right atrium. Coronary artery disease is a common and serious problem in our country, certainly. It occurs when you have an occlusion or a blockage of a coronary artery that leads to ischemia, which is poor oxygenation and poor nutrient delivery to the myocardium downstream of the blockage. The ischemia can lead to chest pain. It can lead to myocardial infarction, which is a fancy term for a heart attack. If severe, it can lead ultimately to heart failure, which is necrosis and death of myocardial tissue. And there's a whole slew of risk factors for this. So hypertension, smoking, diabetes, if you don't exercise, obesity, a poor diet, or if you abuse alcohol, all of these things can contribute to coronary artery disease.